Hi, Mr. Brown. How are you doing today? Oh, you're feeling a little nauseous? Let me check the mark quick. Oh, I see you do have a PRN for nausea, so I can go ahead and get that for you if you'd like. Sure, okay. I can do that. Can you verify your name and date of birth for me? Perfect. And any allergies? All right. Well, my name's Robin, and I'll be your nurse today from the 7 a.m. to 7 p.m. shift. Looking in here, I notice your bed is locked. Side rails are up and you have everything, so that's good. The doctor has ordered Visceral for you for nausea. It's an antiemetic, and that's given intramuscular, so that's going to be an injection into your muscle. And there are 3 places we can do that. We can do the deltoid, which I'll show you here. So when you want to give in the deltoid, you want to find the acromion process and go 3 finger widths below that, and you don't want to, and you would do it there. Because it is ordered with 2 mils, this would not be the ideal place to give your IM today. Another place that you can give it is called the vastus lateralis, and that's, just your thigh in general. So you're going to want to go about 4 finger widths above your knee and 4 finger widths below the pelvic area there, and that's going to be about that. So that would be a good spot that you could put that. But again, we're going to go ahead and put this in the ventral gluteal muscle because it is, again, 2 mils of med. So what we're going to do when you do the ventral gluteal is I'm going to have you roll over a little bit here. I know you're not feeling good. So what you're going to do here is this is the right side. So you want to use my left hand. So we're going to find the greater trochanter, which is right here, and I'm going to have my thumb pointing near the pubic bone, and we're going to give this about right here, between those 2 fingers there is where we're going to go ahead and give that. So I'll have you roll back over. Alright, I'll help you out here, Mr. Brown. Okay, so again, we're going to go ahead and give that in your ventricular, which is in your, that area. So I'm going to go draw that up for you, and I know you're nauseous, so I'll do what I can, but I need to make sure I get everything correct, so I don't want to speed through that process. Your bed is down to the lowest position, side rails are up, bed is locked, you have your call light, so I'll be right back for you, okay? You have your call light, so if it gets too bad, just go ahead and put that light on. So I'm going to come over here into our med room, and the doctor has ordered for nausea that he can have Visceral 50 milligrams. So I'm checking the MAR, and it also says Visceral 50 milligrams, and I'm going to check the EMAR, which also says Visceral 50 milligrams that he can have IM injection. So I'm going to take the vial, and it's Visceral, but this is 25 milligrams per mil. So when I do my dimensional analysis, we're actually going to need 2 mils to get to the 50 milligrams. So I'm going to go ahead and get my 3 mil syringe, 1.5 inches. So I have that. Attach syringe here. And it looks like this vial is open, so we're going to want to go ahead and clean that. And again, this is my Visceral 25 milligrams per mil. Now, you always want to give what you're going to be taking, so I'm going to draw up 2 mils. So this will give me the 50 milligrams that Mr. Brown needs today. So that's 2 mils right there. Go ahead. with a larger needle like this, when you're putting this in here and you go, when you turn it, you're going to want to make sure that that needle is in fact in the liquid. Otherwise, you're just going to be drawing up some air. Get that little bugger out of there. There we go. We're going to draw up 2 mils. So that'll give me my 50 milligrams. And because this hasn't been injected into a patient, we can go ahead and do the scoop and swoop maneuver to recap our needle. Again, that's 2 mils, and that matches our order and our MAR. So I'm going to go ahead and label this. So we're going to put Mr. Brown's name here. And what I got is Visceral, and it's the order is 50 milligrams. So I'm going to write 50 milligrams per 2 mils. I'm going to write that I do in fact have 2 mils in the syringe. The time I drew that up is 13:30, and my initials is I'm the one who drew that up. All right, when putting your piece of tape or your label on here, you always want to label it lower than where your mark is so that you can always see and be able to verify that I do in fact have 2 mils of Visceral in my syringe. All right, everything checks out here. All right, we can go ahead and go see Mr. Brown. All right. Hi, Mr. Brown, it's Robin, the nurse again. How are you doing? Still feeling nauseated. Well, I do have the Visceral that the doctor has ordered to help you with that nausea today. Can you go ahead and verify your name and date of birth? Perfect. And any allergies? Perfect. You must be pretty used to saying that by now. Again, we're going to go ahead and give this to you in the ventral gluteal region, which is near your hip. Again, so we're going to have you roll on your side. If it gets to where you're just having a hard time, a really hard time, just let me know and we can, you know, take our time. We don't want to make it too much worse here. All right, I'm going to check this one more time before I give it, and in fact it's Visceral 50 milligrams per 2 mils. I have 2 mils. The physician order says 25 or 50 milligrams that he needs. So we do have the per 2 mils 50, so we are good to go there. All right, Mr. Brown, we're going to go ahead and have you roll on your side, doing our best to keep you covered up here. We don't want All right, Mr. Brown. Alrighty here. So again, what we're going to do is find the greater trochanter, and that's where my palm is going to go, and then my thumb is going to face towards your pubic bone. And then we're going to kind of just go about right here would be the best place for this injection here. How are you doing? Good. You're going to start in the center in a circular motion to cleanse around all the way to the outer part there. And I'm going to have, I would normally have a Band-Aid to be able to put on after I have injected the injection. And within all IM injections, you want to make sure you do the Z-track method. So I'm going to want to pull a skin tout here, and my needle is still straight, so I am still able to use it. All right, Mr. Brown, you're going to feel a poke, and it might burn a little bit. All right? So you want to hold your syringe kind of in a dart motion, and you're going to go at a 90-degree angle. Remember, keeping your skin taut here to do the Z-track method to keep the medication in. All right, here we go, Mr. Brown. So go ahead and insert that. Checked. Almost done, Mr. Brown. And as I'm pulling the needle out, I'm going to go ahead and let the skin come back. I'm going to activate the safety. And this would be my Band-Aid. Say, all right, how are you doing? Good, good. And looks like everything is good there. So we'll go ahead and we'll have you lay back. Hopefully that gives you some comfort and helps with that nausea here. Let's help you lay back down here. All right. All right, well, we'll give that Visceral some time to work. I'll come back and check on you in about half an hour and see how that nausea is doing. All right, Mr. Brown. All right, I have his bed in the lowest position and locked. Side rails up. He has his call light within reach. And his water. Is there anything else I can get for you, Mr. Brown? Nope. All right, well, again, I'll be back in about half an hour to check on you. I'm just going to document this quick, and then I'll see you later, okay? So I'm going to come back over here and document that I gave him 2 mils at the ventral gluteal location. And it is 1340. And my initials. I'm going to go ahead and sign down here in case a nurse comes and notice my initials and say they don't know who that is. They're able to come down here and look that this is who I am, and those are my initials.